everybody out there and watching BCTV. This is Joanne and my co-host Jim. And today we're so pleased to be able to sit here and talk with Dr. Tortolani. Is that the way I say it? Tortolani.
That's it. Perfect.
He's been a physician here in the Brattleboro area for many years, although he doesn't look it. And we're going to be talking to him about a lot of different topics, but predominantly because he is really a licensed gerontologist as well as a general practitioner. He would like to cover things having to do with medicine and the aging population. So let's jump right in. Bob, I'm going to call you Bob because it's a lot shorter than Tortolani.
Exactly. Thanks, Trey.
I understand that. How long have you been practicing in the Brattleboro area?
Well, I've been fortunate to I practiced for 44 years as a solo family physician here. And I've been retired for about 5.5 years from active practice, but I'm still very involved in medical kind of things. So I even though I'm not in practice, I do volunteer in the walk-in clinic in Brattleboro. I do some teaching at Dartmouth Medical School, and I'm on the board of medical practice for the state of Vermont. So those are all nice medical things. And I also work with, I have a group of veterans that I meet with every Tuesday morning at the American Legion, and I participate in that, and that's been a lot of fun. So doing a lot of things.
Yeah, you don't sound very retired.
Well, I'm doing a lot of things that I'm enjoying. I certainly do miss my patients, but some of the stresses of being in private practice, I don't miss that. So anyway,
good.
And I'm, this whole situation with my concern about medications as we age, it was highlighted by a visit I made to an aunt of mine, a 95-year-old aunt in Connecticut, just about a month ago. She called and said that she had hurt her back, and I hadn't seen her for a while. I said, "Well, come on down. My wife and I will come on down. We'll say hi." And I went down there, and she was a bit uncomfortable, but ambulating with her walker in her little apartment. She's living independently, and she showed me the medications she was taking, and I was very surprised and alarmed because she was taking something called Tylenol PM, which is basically a sleep aid. It's got in it an antihistamine called Benadryl, or diphenhydramine hydrochloride, which has a lot of side effects, particularly in older people. And as a matter of fact, there's a list put out by the experts in terms of drug interactions and drug concerns in older people. It's called the Beers list, BEERS list, and antihistamines such as diphenhydramine, which is in Tylenol PM, is one of the drugs that they're most concerned about in older people. It's in the top 10 in terms of concerns, side effects, and particularly things like dizziness, lightheadedness, blurred vision, fatigue, weakness, and of course, falls. Falls are the big problem as we get older. We started on all fours and a long time ago, and we've been upright. And that upright posture as we get older becomes a problem for us with balance, and anything like an antihistamine can do a lot of damage. As a matter of fact, my aunt said, "Bob, I can't see as well. I've been lightheaded for the last few days. I'm just not feeling very well." And I said, "Gladys, you're on Gladys, you're on a medication that you shouldn't be on. How did you get this?" She said, "Well, my aide picked it up. I asked her to pick up Tylenol, and she picked this Tylenol up, and it's a Tylenol PM. And basically that is used as a sleep aid primarily. And the trick is over the age of 65, and there's nothing very, magical about 65, but we pick that out as an age over which you've got to be particularly careful. Our bodies don't handle drugs, metabolize them, excrete them, handle them basically as you get older the way we do when we're younger. And things build up. We're more sensitive to the side effects of medications. And anyway, she was having a whole constellation of side effects that, my God, I was so concerned that she was going to fall. I said, immediately stop this medicine and get plain Tylenol or acetaminophen, which she did right away. And within 2 or 3 days, she was feeling back to herself again. She still had some back pain, but but she didn't have the dizziness, blurred vision, lightheadedness, dry mouth, all those things, and the great chance of falling. And I did something kind of interesting. I kind of looked in the various pharmacies and grocery stores to find out where these nighttime sleep aids are. And they're not necessarily segregated out such that you might be more concerned and use it only for sleep. They're mixed in with pain medication right next to plain Tylenol oftentimes. And you can see where someone who's unsophisticated, or any of us, might get Tylenol PM rather than Tylenol and not know that that's dangerous. So I said to myself, my goodness, this is a concern. And I really want to raise this issue, even as far as my medical staff at the hospital and the State Medical Society, and maybe even further. I mean, I think any way we can reduce the chances of falling in our older population and our population in general, we should do everything we can, because we know if you're unlucky enough to fall and break your hip, your chance of not being alive a year later is pretty high. It's between 25 and 50%. Wow. When you're over the age of 80. So anyway, these concerns about falling are real. And so anyway, this has got me going. And there's a whole bunch of medications that are out there that are on this list, list. Another category is NSAIDs, things like naproxen, which is used for inflamed joints and inflamed tendons. And there's a high risk of having bleeding, internal bleeding from that drug, and even things like liver and kidney problems, which I've seen in practice. So anyway, we don't know how dangerous these medicines can be. And the very fact that a medication is over the counter, I don't think we give that medication the respect it deserves. People who are prescribed medications, they tend to be more concerned and careful, and may or may not read all the instructions and all the reasons to be careful. But with the over the counter, you're sort of on your own. And oftentimes you don't have a good direction. So I think when you're using over-the-counter medicines as an older person, you should really do that in concert with your doctor, your primary care clinician. You shouldn't, you got to respect these drugs as being potentially dangerous.
They look so innocent.
They do. They do look innocent. And
sometimes the person that is taking those has a need for something, a need for sleep or a need whatever. So they should really talk to their physician.
Yeah.
Do most physicians, are they on board with saying this could be dangerous for you? We used to have at Senior Solutions a full-time Senior Solutions nurse. And she would sit down with our seniors one-on-one as she visited them and go over all the medications they were taking, either prescribed or over the counter. And then she would then meet with their physician and go over everything. Yep. So and we no longer have that person. I think she was an integral part of kind of a safety program for our seniors.
That was a federal program called the Home Meds program.
Right.
And it was free, a free, scrutiny of anything that anybody was ingesting. Like you say, over the counter, which we always included because most people don't consider that real medicine.
That's very true.
It's a good point. And how in the world are we going to be able to get the retail pharmacies and all these other players in the pharmaceutical chain to get on board with recognizing the huge danger it is to older people? Like
Mhm.
most people think that old people just fall down naturally.
Yeah,
And, they're always going, oh, well, somebody falls down or somebody comes in with bruises. Oh, well, she's old. She falls down a lot.
yeah.
And it could just be from the medication.
It certainly plays a role. What I would say, Joanne, is pharmacists are an incredibly important part of the healthcare team.
Right.
They're very knowledgeable. They know the dangers. Oftentimes, it's someone above them will make the decision as to where the medications are placed on the shelf. And honestly, I believe that a lot of things happen because they're legislated. The state may say, if you have a medication such as a sleep aid, such as Benadryl, it's got to be in a specific spot where only sleep aid medications are, with some type of notification that these can be dangerous if taken in excess or taken inappropriately at a wrong time. And actually they can be dangerous even if taken correctly. They can,
Sure.
you get up to go to the bathroom at night and you might be lightheaded as a result of that medication. I always tell people, sit on the side of the bed at night. If you have to get up to go to the bathroom, sit there for a minute and just get your bearings, move your feet a little bit, get your blood pressure up a little bit, and then carefully get to where you're going. And just, it's so easy to fall. It's incredibly easy to fall.
Yeah, and then it leads to more, like you said, earlier death and other serious injuries. I have a very fast anecdotal remark about Tylenol PM experience that I had as a 57-year-old.
Mhm.
I was taking a trip with one of my friends to Sweden, and I knew it was a long trip, and I'm on hyper alert when I'm in a plane. So I went out and bought Tylenol PM,
Mhm.
and I took one or two of them at the airport.
Yeah.
I woke up in Iceland when we changed planes for 2 minutes and fell back asleep in a plastic airport chair. And my friend got me back on the plane. Then I woke up again when we got into Sweden. That was the trip.
Yeah.
And I wasn't even that old, but
Mhm.
evidently, some of these medications are more powerful than you think.
Yeah, each one of us is different in the way we handle these medications. And some people are extremely sensitive to medications and even low doses. I happen to be from a family where that's very true. And that may be one of, my aunt is just one of the family. She hates to take medications and she is sensitive to all medications. And my mother, I actually am fortunate enough to have a mom who's 104 who literally takes very few medications because they really don't interact with her even a medicine like acetaminophen, Tylenol bothers her. She does take a low dose of an antihypertensive drug under the direction of her clinician, but that's the only drug she takes. An occasional. It's and that whole family, they just have never done well with medications at all. Jim, I was going to tell you that that discussion about the nurse you had who was doing that good work, we call that the brown bag discussion in private practice, because very commonly the people bring all their medications in a brown bag, and it's a very time consuming but very important thing, because a lot of patients have more than one clinician involved in their care. They may have an arthritis medicine doctor, a heart doctor, they may have an orthopedic doctor. And even though we try to communicate with each other in terms of what is being prescribed, honestly, in the real world, it's not a perfect world. And oftentimes you'll be very surprised at what people are taking, how they may interact in a bad way, or they may be inappropriately taken for too long. You got to be very, the length of time, for example, you take a drug like naproxen, it probably shouldn't be taken. Certainly, if you're going to take a drug like naproxen for a sore arm or a tendon issue, don't take it for more than a week to 10 days without talking to your physician. because you get down to the 10 to 14 day period, and longer than that, it's a very good possibility of getting bleeding internally or some type of very bad side effect. These drugs are very potent, and even though they're over the counter, they're very potent. So anyway, words of the wise is important.
No, that's a good word. I know a lot of seniors take, they're almost addicted to a leaf.
That's naproxen, yeah.
Yes, and
Naproxen.
they feel like they're getting through the day because they're taking a leave. I think if they put the same amount of energy into physical activity or that type of thing. I know every day I fall down intentionally, so I know I can get myself up.
There
All
you
right.
go.
I usually do it when I'm packing the fire with firewood, and I have to lay down to get it going, and
Yeah.
I push myself up, and I'm
Good for you.
78, and
Yeah,
I can
yeah,
do that.
yeah,
So
yeah.
I can't quite keep up with my wife, who's a little younger than I am. She's in
Yeah.
her low 70s, and she swims 54 laps a day. I can't compete with that.
Wow, that's impressive. Very, very impressive.
That's terrific. Well,
Well,
this is a great discussion because so many of us really do not spend any significant time with our primary care physicians. So we don't take the time to really sit down and talk with them and say, I've got this. You may go in for a certain problem, but like the brown bag idea, I think is wonderful. I think we should encourage everybody out there to make an appointment with their primary care physician and ask if they can bring in a bag of their medications for scrutiny.
yeah.
Well, my Medicare, my private Medicare company for my pharmaceuticals, I won't give the name of the company, but the nurse called me and wanted to go over every single thing that I take. All right.
Yes.
And it was a very good conversation. Maybe you should talk to your physician about because I took this one, I took Benadryl because I have some allergies and stuff, and I did it on my own. And she said, I think you should talk to your physician about it. It was a very good conversation.
Well, that's the drug that we're so concerned about. And
I know.
It's very, very commonly used out there. It can be used for allergies, but there are a lot kind of gentler anti-allergy medications.
Right.
Zyrtec or citrazine is the name of it. That's gentler, and you can use half of a pill, and it's a once a day. Which is it's much better to use something that's longer acting in the lowest possible dose. There's a saying in our older patients, start low and go slow. So any prescribed medication, you start at the lowest possible dosage and then go slowly when you increase the dosage. So start low, go slow. That's kind of a nice add. And the other thing is it's not a good idea to ever start two new medicines at the same time, because if you have a side effect, you won't know which medicine is causing the side effects.
Oh, yeah.
So if you are in a situation, let's say, oh my God, I've got an itch, I've got to use some kind of over-the-counter anti-itch medicine, and then you've got a sore shoulder, and the first time you want to use an anti-inflammatory, well, that's a pretty dangerous thing, but at the very least, check in with your doctor, but don't start them both at the same time. You just
Good advice.
what's going to happen, and it's very, very important. And generally, physicians and other primary care clinicians do the same thing. If they want to start two new medicines, they won't start them at the same time.
Right.
Now, Bob, I'm going to insert something here.
Sure.
You are so full of helpful information. For everybody out there watching this, I think they should watch it twice so that they have the opportunity to jot down some of these helpful tips.
Well,
So
thank you.
I'm telling you out there, listen closely, write down things, and follow up and talk to your primary care physician, because we're all different. We all have different bodies and we react differently, just like the doctor here is saying. Right. So, we want you to take care of yourselves. We don't want you to suffer needlessly with pain. We don't want to terrify you to take anything, but if you're going to get over-the-counter medication, check it out first.
Exactly right. I'm going to add one other category. We've talked about antihistamines, Benadryl. We've talked about NSAIDs, Aleve or naproxen. There's another general category that we've got to be careful about, and it's cold medications,
Right.
syrups that have decongestants in them. There are various decongestants, and they have antihistamine and decongestant combinations. The one is supposed to balance the sleepiness of the other. One is supposed to balance the overactiveness. I mean, the decongestant can make you hyper alert. The antihistamine can make you kind of sleepy. They're supposed to balance each other, and they might not at all. The point is, the decongestant medication can increase the blood pressure. It's those people who have hypertension and are taking a decongestant over the counter for a couple of weeks, they could be increasing their blood pressure significantly while taking that medication. So again, be very careful. It's worthwhile even talking to the pharmacist or the pharmacist helper to make sure it doesn't have something in it that can increase the blood pressure.
Oh,
That's
good idea.
Very good point.
It's just, there's so many little things that people just aren't aware of out there. And although it may be scary to hear this, it's better to be aware of these things and to reach out to your pharmacist, to your clinician, and ask questions. And just because you just don't want to get hurt by something you're taking to help you. That's really
Right.
a crucial thing. Yeah.
Good point.
Yeah, good.
Yeah, and what really we have to look out for now, things are packaged so attractively.
Oh, yeah.
And they look so harmless.
Mm-hmm.
So we have to just be on our guard.
Mm-hmm.
And like you say, just ask questions, check with your doctors.
Yep.
This is really an important conversation, because I'm sure a lot of us out there have either inadvertently done the wrong thing and taken, a lot of Aleve because of a pain or something,
Sure.
or taking the decongestant syrups because you had a bad cold. This year, a lot of people had very lingering, deep cold.
No question. And again, people want to get help, and these medicines can be helpful, but every single medicine is a two-edged sword. It can help, it can hurt you.
Right.
And the clinician who's prescribing oftentimes, and the pharmacist who's giving the prescription drug, does alert you to these things. However, the over-the-counter, you're on your own, the herbal medications, the vitamins, you can be taking too much of any of these things. Yeah. The over-the-counter meds, they all can, you're kind of, there's a saying, the doctor who treats himself as the patient who treats himself as a fool for a patient, or the doctor who treats himself as a fool for a patient. The point is, when we're out there looking at that shelf full of medicines for a sore shoulder or a cough or an itch, you got to be careful, because those medicines are marketed to sell to you. They may be helpful, they may be hurtful, and just buyer beware. And that's all I can say. These medicines are powerful. Aspirin is probably one of the most powerful medicines ever produced. Acetyl salicylic acid. It was produced about 150 years ago, I think, in Germany. Wow. Maybe in the 1890s. It's an incredible drug. Aspirin has so many effects on the body, but it's there, 500 of them for a few dollars, right? That means they're benign. It's a very strong drug. It's really it's an amazing drug. If you were going to be on an island somewhere for a long time and you needed to get one medication, that might be the one to take with you, because but again, it's got to be taken safely under the control of a clinician. Yeah.
Right.
Yeah.
This
I
is
take a
very
baby aspirin every day based on my neurologist saying you need to take a baby aspirin.
Yeah.
Yes, Jim, and you're not a baby.
I sometimes I feel like one.
Yeah.
I was going to ask
It's
Bob
obviously helping.
I was impressed that you're meeting at times with vets.
Yeah.
All right.
Yes.
I'm sure you, when you are having a meeting with them, you do talk about the dangers of drugs.
I do.
And I just want to know, what is their reaction when you're explaining the rationale for that?
Jim, I try when I'm with my veteran brothers and sisters, I try to not wear the medicine hat
Right.
too deeply or too much. I try to give them some advice here and there, questions particularly around all the respiratory infections that are going around and certain things that
Right.
come up. But I don't want to be on stage for too long. I help to facilitate incredibly good conversations. And once again, these meetings are open to any veteran, any National Guard person, any man, woman, veteran. Every Tuesday morning, we're in our 5th year. It's at the American Legion in Brattleboro. We have between 25 and 35 people who come every day, every Tuesday.
We have at Senior Solutions a vet-to-vet program where we match up vets together, especially young vets who have just come back from wherever. They're matched up with an older vet, and has been a great experiment, positive experiment for our older vets that are retired.
Yeah.
They have a lot to offer.
Younger vets.
Yes.
Bob, hey, Bob, if I'm not mistaken, several years ago, you were very instrumental in getting the vet-to-vet visitor program off the ground there at the American Legion Post 5.
Yeah, I was involved
You were
in that.
very helpful.
Yeah. Anything to do with vets, I'm all for it. I'm a great fan of veterans. Yeah.
Good.
Well, it sounds to me like you're a great fan of a lot of people. You know, you help out at the free clinic in Brattleboro.
Yeah.
And tell me just a little bit about what you do when you're teaching. I know you teach, you said small groups, and you like to think of it as teaching medical arts.
Yeah. Well, I've been involved for many years teaching Dartmouth medical students. We used to do it in our offices a lot, where, some of the fine points of physical diagnosis and history taken, we could teach over the course of I usually have a student for 2 years, every other week for 2 years. That program has unfortunately stopped because there are not enough physicians in private practice anymore that can entertain, easily students into their offices, because people are getting too busy, unfortunately, and it may not be as possible to have students anymore. So we tend to go up to the medical school, and we have people from the community who we call simulated patients. They are used so that the students can get a history and do a physical examination, and the simulated patient knows how to answer questions and knows how to, he has a certain problem, and he's been taught, or she's been taught, how to answer the questions, and the students, it's actually a very good process. And I think a lot of medical schools are doing this now, and the great advantage is they have an older or another clinician watching them and kind of giving them feedback, and it's very, very helpful. And that's been very good. The walk-in clinic we have every Tuesday night, 5 o'clock to 6:30, only an hour and a half, but we have always 2 clinicians there. And
where's it located, Bob?
It's on Clark Avenue, right near Dr. Lebo's office, right behind Dr. Lebo's office. He's a podiatrist. Kim and Dave Lebo, right across from the hospital. Actually, it's Clark Street is right across from the hospital.
Oh, that's good.
Belmont Avenue. So anyway, we have a nice little office there, and anybody can come in. And some people who are between doctors, people who can't find a physician yet, if they want to come in, we're happy to see anybody at all times. And by the way, before I forget, I wanted to, one of our veterans is Mark Anderson, our Windham County Sheriff, and a great guy. And he's got a very nice program that helps older people who are oftentimes isolated, and they may well be, generally these are people living independently alone. And if people want to get, want to take advantage of this program, the program works out that someone from the Windham County Sheriff's Department will call that person either daily, or depending upon that person's schedule of being in town or out of town, will call him whenever he's going to be at home. And if they don't answer, then there'll be a backup person to get in touch with, to make sure that the person is okay. And I think that's a wonderful program, and one can take advantage of that, according to Mark, by either going online or calling the Windham County Sheriff's Department. And it's called, I think he said it's called, he told me what it was, Keep It Safe, or Be Safe, or something to that effect. It's a nice program.
Nice.
And I highly recommend that people who are living alone and are aging in place, if you will, take advantage of that program, if they don't already have a family member who is doing that same thing. It's always good to be checking in on your older people who are living independently.
Well, we'll have to look into that, because it would be, if we don't already have it, it would be something we should add to our website resources.
Yes.
So that we can connect the dots.
Absolutely.
And yeah, that's wonderful to learn.
It's a great program. It's been going on for many years now in Windham County.
Nice.
And again, through the Windham County Sheriff's Department.
Great. Thank you for sharing that.
You're very, very welcome.
Great. Well, I don't know. What have we forgotten to ask you?
I'm afraid we might have given
when we
our
forget, we always remember about 2 hours after the program
That's
is
right.
over.
My concern, Jim and Joanne, is that we've probably given too much information to our people. But at any rate, I guess too much is better than too little. Yeah,
That's right. And I think we've only gone about a half hour, so that's not so much that we're burning people's brains out, but it is enough for the type of information, because it's a little more technical. It's a little, specific. It's very important.
Yeah.
And again, I can't encourage people enough to watch this a second time, at least a second time, and to share it with their friends. Because this could be a lifesaver.
Yeah.
Right. But Bob, I think you were successful in giving concrete examples. And when people hear that, they can identify with the person you're talking about. I think you did a great job with that approach.
Well, and I thank you, Jim, for that feedback. Yeah. I think it always helps to connect a story with, medication.
It does.
Yeah,
I'm a retired educator after 54 years in education.
Wow.
The last 15 being a principal, and I'm still alive. So that's amazing.
Yeah, that's impressive. Very impressive.
Well, I'm impressed by both of you guys. That's all I can say.
Well, thanks for having me and having us, and appreciate it.
The minute I heard about your concerns about these over-the-counter medications, it really resonated with, I think, the condition that a lot of us, as we grow older, find ourselves in.
Absolutely.
We get more aches and pains, we have this and that, and we always are looking for the easy solutions.
Sure.
Which there it is, sitting on the counter in your drugstore. And this is a really good warning and guidance for people. Thank you so much.
I'm just going to add something else, that if you have an ache or a pain, it may be better to apply something to it, either heat or a moist heating pad, or a moist compresses, or an ice pack, or a vegetable from your freezer with a towel around it. If you have an itch, you might want to apply some type of just a lotion or something that's a moisturizer. Anything that we can avoid taking internally is a good idea. A lot of times, like dental pain, you can get a lot of benefit if before you get your tooth out, putting an ice pack on your face. If you have a very bad toothache, rather than taking a very strong pain medicine that might knock you over. those are thoughts, Anyway, there's a lot
No,
of
that's
a lot of
true.
things you can do to help yourself, and it doesn't always include taking something internally.
Well,
Good,
I
Betty.
have an idea that I will talk to you about after we finish the Zoom.
Yeah.
And I think that, these kinds of tips are very welcome to people, especially when they may have already had a bad experience,
Mhm.
and this would offer them a much better solution.
Sure.
So thank you. Jim, you have any last minute questions or
No,
experiences you want to share?
No, I think those are very successful programs.
Well, I think you guys are terrific. Thank you.
Thanks,
And
Jim.
thanks,
Thanks, Joanne.
yeah. Thanks to
Great.
everybody
Great to
out
see
there
you both.
listening. And I'm sure we'll be back. So we're gonna pick Dr. Tortolani's brain more than just one time.
It'll be
Okay.
fun. I'd be happy to see you again anytime.
All right. Stay well, stay healthy, and we'll see you soon.
Happy New
Thanks.
Year, everybody. Yeah.
Yep.
Bye-bye.